The Access Vascular HydroMID is a radiopaque midline catheter comprised of a novel hydrophilic biomaterial that has been shown to be effective in reducing thrombus accumulation in vitro and in vivo models and in clinical use. The HydroMID catheter is available in multi-kit configurations: an IR kit, a basic kit, and a maximal barrier kit. HydroMID is indicated for short-term peripheral access to the venous system for intravenous therapy, including but not limited to the administration of fluids, medications, and nutrients, the sampling of blood and blood products. Therapies not appropriate for HydroMID midline catheters include continuous vesicant therapy, parenteral nutrition, infusates with extremes of pH or osmolarity. HydroMID is rated for a maximum power injection flow rate of 6 milliliters per second. Disinfect the work area surface with a facility's approved disinfectant. Clinicians must maintain strict aseptic non-touch technique during insertion. Preparation for placement of the HydroMID. Assess for appropriate device placement. Ensure there is a clear indication for central access prior to placing the HydroMID. Select a vein and insertion site by assessing patient anatomy, condition of vessels, and previous history. Common veins used for insertion include the basilic, brachial, and cephalic veins in the middle of the upper arm. Prepare to insert a HydroMID by gathering all supplies needed. First, prepare the catheter and supplies for insertion by opening the outer packaging and removing the sterile pouches within. The HydroMID is inserted by a qualified, licensed healthcare practitioner. When placing the catheter, follow the established organizational policies and procedures, evidence-based practice guidelines, and the manufacturer's directions for use. Using Sterile Technique, transfer the sterile contents contained in these pouches onto the sterile field. Leave the catheter in its protective sheath. Retract the catheter approximately 1 centimeter from the sheath and occlude the other end. Orient the sheath so that the end of the tube not containing the catheter is facing upwards. Flush catheter with sterile saline syringe until air is purged inside the catheter and protective sheath. Reinsert catheter hub into sheath to prevent saline from leaking out. Once all air is evacuated from the sheath and flushed completely, clamp catheter and remove syringe. Leave catheter in its protective sheath during this time and lay on a sterile surface. Note: catheter must be hydrated for a minimum of 5 minutes before insertion. After the minimum 5 minutes of hydration is complete, the catheter is ready for further preparation. Measure the catheter and trim to the appropriate length. Catheter insertion. Once the catheter is prepared, proceed with your normal insertion procedure, accessing the vein, threading introducer and catheter. Notice that the catheter will feel lubricious and less stiff than other catheters. Verify the brisk blood return and that the catheter flushes easily. Secure and dress catheter appropriately.